Hello. Welcome to the Pars Health TV channel. We hope you're having a good day and you are happy and healthy. In this channel, we give you tips to keep you healthy and out of trouble. In this video, we want to talk about how to treat and reverse a fatty liver. This video is for educational purposes only, and if you have any specific condition or illness, you should consult with your doctor. The liver is one of the most crucial organs in the body. It is located in the upper right side of the upper body, it is beneath the diaphragm, and on top of the stomach, right kidney, and intestines. It weighs around 3 pounds. The liver does a lot of things in our body, and its role is vital to keep us alive and healthy. It produces blood plasma, bile that helps to carry waste products in the body, conversion of glucose and balancing it, regulation of amino acids levels in the blood, processing hemoglobin, removing drugs and any types of poisons from the body, regulating blood clotting, helping the immune system by clearing bacteria, and many other functions. As you see, the liver influences every part of the body and its functions, so if you hadn't paid attention to it before, that's the time to change your mind. In today's video, we are going to be sharing with you ways to treat the fatty liver. Fatty liver is one of the most common liver problems all over the world. It may not have serious symptoms, but it will affect your liver function. Stay tuned with us to get the information about how to treat fatty liver with diet tips. If you like topics like this, make sure to subscribe to our channel and press the bell icon to see daily videos just like this one. Alright, let's get started. First, let's know what happens to your liver in non-alcoholic fatty liver disease. The reason why this happens a lot is that it is related to insulin resistance. Fat begins to accumulate in your liver and the fat starts to slowly infiltrate into the liver, and this is what doctors call non-alcoholic fatty liver disease. The fat that has been stored in your liver can lead to inflammation in your liver. This is the condition called NASH. Non-alcoholic steatohepatitis means that it can damage your liver tissue. Number 5. Weight loss. Weight loss is one of the best things you can do to your liver. For people who have any type of liver disorder, weight loss will lessen the damages to their liver. Actually, for fatty liver, this is the most important treatment. Keep in mind that quick weight loss will harm your body more than before, and the key to success for you is to lose weight gradually. Losing weight around 0.5 to 1 kilogram per is the best amount that has been suggested by many doctors. If you lose weight quickly, it can lead to fat deposition in your liver. So, that's not helping you, even causing more damage. For people who do not have fatty liver, quick weight loss can cause fatty liver. Number 4. Have raw vegetable juice. When vegetables are kept raw, a lot of the nutrients are retained because some vitamins like vitamin C and the B vitamins are destroyed by heat, both of which are important for detoxing. There are some vegetables that are better to be cooked. However, like cruciferous vegetables, broccoli, cauliflower, cabbage, to protect the health of your thyroid. Quickly boiling them before adding them to your juices and smoothies will help. Vegetable ideal for a liver detox include cabbage, kale, Brussels sprouts, celery, lettuce, broccoli, cauliflower, asparagus, beetroot, carrots, avocado, cilantro, collard greens. Number 3. Eat healthy fats. You may be thinking, I have already too much fat circulating. I should be adding more fat-free foods. Fat-free foods or low-fat foods are totally terrible for your health. The fattiest organ in your body is your brain, which is at least 60% fat. So when you limit healthy fats like omega-3 and saturated fats, your brain suffers the most. It's the same case with healthy cholesterol levels, which are important for hormone production and lining your cell walls. Omega-3 fatty acids are especially helpful for reducing inflammation in the body. When you have a fatty liver, you want to keep your liver from becoming inflamed. Avoid eating too many omega-6 fatty acids, which are found in seed oils, baked goods, some nuts, and seeds. Your body can't function without fats. Just make sure that they are healthy fats. Foods containing healthy fats: avocado, coconut oil, olive oil, wild salmon, mackerel, sardines, butter, eggs. Number 2. Supplements for liver support. Milk thistle, silymarin, is well known for being good for the liver. Not only does it help the liver to get rid of toxins, but it reduces inflammation in the liver and increases insulin sensitivity as well. A dosage of up to 150 milligrams 3 times a day is safe for short-term use. But a dose of 50 to 150 milligrams per day can be used regularly to maintain the health of your liver. Dandelion detoxes the body and rebuilds the liver cells. Dandelion also contains vitamins and minerals including vitamin C, so it helps to reduce inflammation. You can drink it as tea or add it to your meals. You can use 2 teaspoons of dried dandelion 3 times a day or 100-150 drops of tincture a day initially. Turmeric is a powerful spice that helps to detox the liver and helps to reduce fat in the liver up to 78.9%. This is due to curcumin, which is what makes turmeric yellow. The health benefits of curcumin are enhanced by piperine, which is found in black pepper. You can take 500 milligrams of turmeric a day to achieve these benefits. Number 1. Avoid alcohol. Every time you drink alcohol, it can lead to inflammation and cause damage to your liver. When you have a fatty liver, imagine what happens by drinking alcohol. So, try to avoid drinking alcohol as much as possible. It takes the body approximately an hour to process 1 alcoholic beverage. This time frame increases with each drink. The higher someone's blood alcohol content, the longer it takes to process alcohol. The liver can only process a certain amount of alcohol at a time. When someone has too much to drink, the alcohol left unprocessed by the liver circulates through the bloodstream. The alcohol in the blood starts affecting the heart and brain, which is how people become intoxicated. Chronic alcohol abuse causes the destruction of liver cells, which results in scarring of the liver, cirrhosis, alcoholic hepatitis, and cellular mutation that may lead to liver cancer. These conditions usually progress from fatty liver to alcoholic hepatitis to cirrhosis, although heavy drinkers may develop alcoholic cirrhosis without first developing hepatitis. Mixing alcohol with other medications can also be very dangerous for your liver. Never take alcohol and medication simultaneously without speaking with your physician first. Risk factors and causes of non-alcoholic fatty liver disease include obesity, diabetes, high triglyceride levels, thyroid problems, and high cholesterol. Avoiding or limiting your sugar and refined carb intake is one of the best ways to combat fatty liver. Reduce your exposure to toxic chemicals like BPA, phthalates, parabens, fire retardants, and pesticides. Adopt a healthy diet and lifestyle to reverse fatty liver or prevent it. Exercise is important as well, as including foods like healthy vegetables, choline, liver, and herbs, and spices. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.